microscope. So honestly, my microscope it's working perfect because of this guy. So if you get unclear images, if you have diagnostic difficulties, if you get actually you miss the babesia, or yeah, you have some problems between differentiation between babesia and artifact, or is very cloudy view. Always are you thinking, sometimes are you thinking it's the microscope problem, but actually it's the maintenance. Yeah. So you need to have a cleaning kit for lenses. I'm using isopropyl alcohol. It's not something dedicated, but of course you can provide from market, yeah, dedicated cleaning kit. But I'm using ear sticks or special cotton material with isopropylic alcohol, and of course you need a little bit of patience and pay attention. So I have a few images for you just to see. It's nothing special, but yeah, we need to do it actually. Yeah, we need to do it, and to keep a very clean image. Apart from this, you need to clean the 100 objective every time when you use it. I'm doing every each slide actually, and I'm not using something very special, just a handkerchief or something, paper, very fine paper, and I just clean the objective. For 40 or 60, if you have 60x, yeah, always you need to use cover slip, and I'll show you. I have some movies for you today. In this night, actually, is not triple X movies, but of course, yeah, it's something special anyway. Depends how often are you using the microscope, and in base of this, you need to have I don't want to say a timetable and a very good plan, specific or very sharp plan for this, but you need to do it again. For dust, to keep the dust away from your microscope, it's better to cover when you don't use the microscope. Special boxes for the objectives that you are using rare. Okay, so this is for maintenance. Now I'm going to explain a little bit the parts, what the parts are doing, and what are for. And of course, if you are using them very correct, you'll have good results for sure. So I'll start with the condenser. The condenser contain a diaphragm here, and usually you should put it in the middle. But of course, you have choices. Yeah, you can have closed diaphragm. You can put small diaphragm, but the contrast is increased. So when you close the diaphragm of the condenser, it's better to have non-stained smears. For example, when you are looking for crystals, urine, sediment, for example, or parasites. Yeah, you need to close the diaphragm to have better contrast. It's low light, but it's better contrast. I'll show you some images to understand better what I want to say. Like this, for example, this is an image from urine. There are some crystals, yeah, so you can see the shape of the crystals. But if you close the diaphragm, you see much better, yeah, the shape of the crystals. So you increase the contrast, closing the diaphragm. Okay, something similar you can have if you put in the low position the condenser, like here, or if you need more light, for example, when you use oil to have more light in cytology, for example, you can put the condenser up, like in this image. And I have a small movie here for you. So if you put in up position, you have more light, but you decrease the contrast. It's better for cytology and for immersion oil objective. Yeah, and if you put in low position, again, you get more contrast, and it's better for parasites and for non-stained smears or slides. Okay, so I have here a small movie just to see how it's working on the microscope. So you see now you open the diaphragm maximum, so you have more light again, and then you close the diaphragm and you have more contrast and shape of the crystals or parasites, eggs, something, or I don't know, hair shaft, yeah. Okay, another thing that I want to say, and it's better because sometimes, again, you get very, very nasty light and you don't want, you don't know why. I don't know, but the providers, some providers should explain to you when you buy a microscope, if you have halogen lamp and it's not LED, yeah, if you have halogen lamp, you need to have a blue filter. If you don't have a blue filter is this one. Yeah, it's a glass, blue glass, and nothing special. Yeah, and you need to put it on on the light, and cover the source of light just to have very nice and clean light. Like here, for example, is without blue filter, so the light it's yellow actually. Imagine how the cells should be on this yellow light. Yeah, jaundice probably. When you put the blue filter, the light becomes suddenly it's white. Yeah, it's very important. Probably, yeah, it's very not important thing for some people. It's a piece of glass, but look the quality of light. Yeah, and on the movie, using the filter here is without, so very yellow, and then when you put the blue filter, the light, yeah, it's suddenly very white. Good. Another tips, another tip is the cover slip on the slide. The cover slip on the slide, it's about this one. I mean, the small glasses, they are used for the histology slides actually, but if you are using the microscope in the clinic, you need to have them. They are very useful for I don't know, scrubbing slides, to see the higher shaft parasites. And yeah, I'm using all the time for cytology, but it's for 40x. I'll explain just a second. So it's for this guy for 40, because this objective is special for histology, and all the slides on histology, they are covered by the small slides. Yeah. So it's about optic. I'm not good in this, but of course, this objective is special for histology, and the light and the image is clear when you use the cover slip. So you don't need something special. You just put the very small and tiny and fine cover slip. You cover the slide, and then you just examine. You put on the microscope. You don't need anything for cytology. Yeah, I'll explain for other type of samples. For parasitology, it's a little bit different. But for cytology, if you need to have a very clean image with 40, use the cover slip. It's better. And so probably for some people that you don't have very good connection in this night on the internet, probably this image now is very clear for you, but for me it's not, because it's a little bit cloudy. Yeah, it's without cover slip. It's 40x used for cover without cover slip. If you put the cover slip, you can have the differences in between. It's more clear, so you can have a better image. And to demonstrate this, I have, of course, a small movie to explain how is working the cover slip under microscope when you try to get the very nice image. So this is cloudy without cover slip, and then I'll put the cover slip and you see very clean image. I'm sorry, because probably you have some lag, and I did a mistake, and it's my apologize. Today the devices are very smart, and I was not very smart, because I did movies in 4K, and when I tried to put them on PowerPoint, was a nightmare because too much information. So you see here, it's very clear image. Okay, I think it's convincing, and we don't need more explanation about that. So for better and details, you need 100, but 100 usually it's with oil. They're called wet objectives. Yeah, and you need to use immersion oil. So it's writing down here on the objective, it's writing down oil. On the market, you can find, if you want, but they're very expensive, 100 without oil. They are dried. But honestly, from my experience, if you want to have very good image and very clear for details, it's better to use the oil. Yeah, wet objectives is better. Okay, so don't put too much oil, because it's after that all over the place, and you need to clean your microscope, and it's very difficult after that to clean, and yeah, it's oil everywhere. So you don't need too much. Put a small drop, and then with patient patience, you need to, yeah, I put in the middle the diaphragm. You can increase if you want more light. In your microscope, the bulb, the light is not very powerful. Yeah, you can open the diaphragm, and you can put in the higher position the condenser, just to have more light on the slide and to see the details. But if you have powerful microscope, you don't need too much. Okay. So this is the image, yeah, with oil. Yeah, I'm not going to say something about cytology or details, but yeah, for everybody, we have here neutrophils and red cells, red blood cells, yeah, and some, yeah, active degenerated neutrophils, eosinophil here, and some round erythrocytes. Somebody can say IMHA, yeah, because the spherocytes are specific for immune-mediated hemolytic anemia, but it's not our topic for this night. Okay. When I said oil, immersion oil, sorry, yeah, use the immersion oil from the market, not use whatever oil you have, in the kitchen, or on the store, because you destroy the objectives. Okay, this is the first part of my presentation. I finished with the microscope. Okay, in second one, we will try to see how to get the perfect smears. I'm sure many people are doing. So it's, like a coffee in the morning. But for some people, it's a nightmare. So you need to have a few things in mind, and yeah, to try to to do it. Of course, we'll start with the blood, because the blood it's the most often used to check on the microscope, to see the red blood cells, the white blood cells, to do counting, and yeah, the procedures, it's easy. You need a drop of blood, and use the microscope slides, and you don't need a spreader. Very, you can buy a spreader from the market, but use the money for something else, because you can have another slide to get very, very nice smears. Of course, you put in the 30-40 angle the slide, the spreader slide, and then very brief, you just made in advance the fluid, and the most important is to get a very um, thin film of the cells. But of course, this is the theory. I'll show you some movies and pictures because I think it's better to understand. And the practice is very important. You need to try. I'll explain. Of course, everybody needs to have monolayer of cells. Of course, you don't need thick area, but you will get in the beginning of the slide. Uh, yeah, you have a thick area, and then Fedger's age that are important to check the white blood cells, and on the margins um, of the smear you have you need to check to see the white cells. No offense, I know everybody knows how to take the blood, but honestly it's just an advice. If you want to avoid artifacts, uh, use a very small and fine needle. You just put on the vein and then very fast, so you don't use any container with anticoagulant, because the anticoagulant can change the shape, especially of erythrocytes. So better for avoiding the artifacts, put use the fresh blood if you have the animal, because yeah, working in the clinic you have the animal. I'm working in the lab, and I'm sometimes yeah I need to use your samples, and sometimes I have many artifacts because of not that much blood in the tube. So the proportion between anticoagulant and the blood, it's abnormal, or yeah, you are not fast when you put the blood in the tube. You don't mix, or you mix too much, and yeah, there are many factors that can be involved in artifacts. Um, but yeah, I'm not going to say too much about that. Of course, I get tubes with anticoagulant, citrate, and EDTA. Usually because of the transport, or if you keep on the fridge, the cells are going to um, separate, and I gently, very gently mix move the tube just to mix the cells, and don't do too aggressive, because you can break the cells. And in the same way, I'm using a very small needle, and I just press on the needle, and the pressure, it's doing a very small drop. It's enough to have a very nice smear and monolayer. And if you see, all the slides are labeled. It's very important. And the drop, it's opposite. Why? Because if you think, when you use it on the microscope, you need to check the at the end of the smear, where you have the Fedger edges, yeah. And if you put the drop very close to the label, yeah, you will get the Fedgers in the um, one side, and it's very difficult to put the immersion oil because the slide can slap um, very close to the condenser. Okay. I don't see the chat if I have the questions, but anyway. So next fluid is the urine. Urine, it's usually for urine you need to do an examination under microscope without staining, to check the crystals, to check the urinary casts, the protein casts, the nematodes, for example, or eggs of the parasites. Of course, you need to use the centrifuge using the Eppendorf tube. I'll show you the pictures. You can find many references. Usually we do in our lab 3 to 5 minutes at 1,500 rotation per minute. So it's enough to get very good sediment. Of course, after centrifugation, we will separate into portions, supernatant and sediment. Supernatant, we decant it carefully, leaving a small amount of tube. We can use a pipette gently mixed with the sediment, and then you can transfer a few drops on the microscope slide to have a sample. Of course, we do one non-stain just to keep the eggs of the parasites or crystals, because when you do staining, you wash, you clean the slide, and you can lose actually the crystals or the parasites. On the market, you can find something that people are using to see better the sediment. Yeah, and here, of course, you need to use a cover slip. Yeah, and usually we use 4x or 10, depends. If you want to see details, you can go in 40, but not that much on unstained, I mean, slides. So centrifuge, 35 minutes, 1,500. Yeah, you have Eppendorf tubes. And this is an unusual method. I wouldn't recommend for beginners, because some cotton, rest of the cotton, you can get them on the slide, and probably you can say is a monster on the urine or something. Usually we use the Pasteur, if you want, pipette. So again, one stain for crystals, yeah, and parasites, and one stain slide. Effusions, you can do abdominocentesis, thoracocentesis, so all the effusions, you can get it by punction. Usually it's better use EDTA, so anticoagulant. you keep them in Eppendorf tube, you do centrifugation, so it's something similar that you have seen on the urine. Of course, about staining, I have a slide with staining, so we'll speak a little bit about staining, so no worries. Um, Here it's thoracal fluid, so you need to do it. I'll escape. This is a CSF fluid, yeah. So and yeah, you put them on the cone tubes, Eppendorf tubes, if you want. Looks like a pass or kilo something. So you see, all of them are labeled. You can have very thick and difficult to put on the pipette on the tube the fluid. So be careful because the needle, if it's not very um, um, tight, you can spread the fluid everywhere. And then of course you put in the on the centrifuge, and then yeah, you use the Pasteur pipette here to through the supernatant in the special bin. Okay. And then with the Pasteur pipette, you have the sediment. You just gently mix a little bit. You spare a few drops. You put on the slide, and then you can have cover slip, or you can do smears, and then staining. Okay. I think it's enough. You need to dry to avoid the artifacts. It's more important for blood, not for this type of fluids. Okay, you can have impressions, smears, scraping, brushing, so samples from incisional and excisional biopsies. And yeah, we need to do the slides for this just to have a very fast diagnosis, to have an orientation. It's very useful for cytology. If you do excisional biopsies like here, this is total mammectomy, yeah, and you want to see, to check on cytology what is going, of course, you find the nodule, the tumor, you just clean the skin, yeah, uh, cut the skin, and then you evidentiate the nodule. And you need to be careful because on mammary gland, for example, several are very cystic. You can have many cysts, and if you do pressure on it, all the fluid is coming and on your face, so you need to put the mask, not for COVID. see the fluid, it's coming when you do the section like this, for example. Yeah. Because it's too much fluid, we can do excess of the fluid. You just using the um, something very dried and paper, just to avoid very thick smears. And then you do imprint. It's impression smear. You dry very fast. And then you can stain them and examine on the microscope to see what type of cells are, or you can send to the cytologist on the lab. Another cases in clinics when you have ulcers or on the skin, and it's very easy to approach this method because it's wet, the lesion. You just do impression smear and dried and examine. Of course, stain and examine. Scrapping is another method to get the smears. But of course, you adapt in based of what type of lesion you have. And it's, when the skin is normal, slight, moist or greasy, of course you can do different methods, superficial or deep scraping. And usually you can use a slide, so glass slide I'm usually used, or a scalpel blade if you want to be a little bit aggressive, or to get the cells from deep. And yes, of course, some of them you can use with cover slip to check the parasites, for example, or fungal structures. And here we have very nice cat. He's very kind and patient. And with the blade, you just do scraping. As an advice, on the beginning, on the surface, you have a lot of dead cells. It's a kind of detritus with bacteria, and they are not very useful for diagnosis because they are coming from the environment. So first, you need to do scraping and then clean the place, and then you can do second time, and you'll get deep and nice cells from the lesion. Here we use the cover slip and lactophenol. Lactophenol, you can find the lactophenol in the market. On the market, it's a kind of clarifiant. You can have very clean image, and the lactophenol, it's diluted actually the ketene, for example, from parasites or colorant and melanin, and you can have a more clear image on the microscope. Yeah. So keep in mind lactophenol. In some clinics, natrium hydroxide, if I'm not wrong, but lactophenol is special and it's very good. I recommend. Another method to get smears and samples is brushing, but yeah, we we use a lot of things from human medicine, so this is for endocervical and vaginal smear testing, but they are very nice, and I'm very happy to use them. For example, when I have an aggressive cat, to do cytology from oral cavity, and sometimes it's difficult to get the samples. If you have a cavity, yeah, if you have I don't know, uh, another type of lesion that you can use the brushing. Yeah, it's very useful, so you can find on the market. This is the detail. And here we have a movie. So you just cut, if you want to do, from excisional biopsies like here, you just cut the mass. With the paper, you put away the excess of fluid, and then you have very nice cells and on the slide. Good. So here I finished the second one. If you have the questions, we can have at the end a session for questions, if you are still here.
Yeah, I think this is the best idea, to have the questions at the end of the presentations, and you can carry on with your third presentation. We have just one question from Alina for the moment, so you can carry on with your third presentation.
Okay. Let's try to share. Let's understand what is going here. Stop sharing. So this is not my night. It was a long day. Okay.
So are you okay?
Yeah, just a second. Okay, seems to be okay. Good. So the third one, it's about finding the aspiration. I don't want to speak too much about technique, but yeah, for some people it's very probably for some people it's new, for some people it's very easy to do it, but sometimes I get annoyed because my colleagues, some of them they don't want to do it, and it's easy technique, and I'll be very happy that don't go in the clinics to do that, and yeah, staying in my lab to check the slide, and doing a very fast diagnosis. But anyway, um, finding the aspiration is a technique to take some cells, and of course the cells we need to put them on the slide, and someone somehow need to check them, to see them, and to have at least an orientation, and sometimes yeah, a good diagnosis. Um, Here is the theory. You can have the theory in the books, you can have references, but yeah, let's see actually the movies, and I'll give you a few tips, because find needle aspiration means find needle, so don't use 18 guards, sorry, use fine needles. So 22, 25, 27. I love that. Yeah. And yeah, why? Because look how it looks like. Yeah, it's very thick, and if you put them in the tumor or in the mass, you just break the tissue, break many capillaries, and it's very bloody. You don't need the blood on the smear. You need the cells for diagnosis. So don't use it. This one I don't use some neither for bone function. Is not good for bone as well. So don't use it. Use 22, 23, yeah, 25 better, or 27, and yeah, you'll get not that much damage, is not painful, of course, so you have a lot of advantages. It's not painful, yeah, you get very nice cells. Of course, you need to adapt in base of where is the mass, because if it's deep, yeah, you need to use a very long needle. But this is another topic. Yeah. So just a few seconds, finding the aspiration. This is an old movie. You need to clean the place. Some people are washing, and yeah, you can be very careful to avoid the infections. So you put the needle on the mass, you just change the angle, you change the position on the surface, on deep, and this is an aspiration. So that's why it's fine needle aspiration, because you use the syringe, with the force of the syringe, you just take the cells. Honestly, I'm using very rare this method. I'm using the non-aspirative um, function. If it's not working and I don't get the cells, that means the structure is very dense. And yeah, in that case, I will take the syringe, and I'm using the fine needle aspiration. So this is a technique to have a very thin monolayer cells, but you need to be gently, because if you have, for example, fine needle aspiration from the liver, the hepatocytes are very, very breakable, very, very sensitive, and you can have just cytoplasm on the slide, and it's not useful for diagnosis. So you don't put too much pressure on the slide. Here is a staining, but yeah, we have another slide with staining. If you have excisional biopsies, yes, you can do it like this, or you can use in live animals as well. Put the needle on the mass, and it's the same technique. And the cells are coming on the lumen of the needle. Of course, here I exaggerated a little bit, because yeah, it's very dead animal. Here is a piece of mammary gland. And then I have the syringe with air inside. And very careful, we just spread the cells on the slide. You can do it again. And then very gently, you can use the needle to spread the cells on the slide, or you can use another slide to do that. And dry it, and then staining and examine on the microscope. This is aspirative one, but I have another movie thing. Everybody are alive? Okay, so don't kill yourself if you don't have a good image. Very fast about true cut biopsy. This is actually bone biopsy using Jamshidi tools. Is a kind of very sharp needle. You get a cylinder, and this cylinder is very useful. You can use, for example, for histology, but of course it's very useful for cytology as well, because you can have, like here, some cells. You can press a few cells from the needle on the slides, and you can have very fast cytology. And then the leftover, you just put the cylinder on the cassette, or in, I don't know, Eppendorf tubes with 10% formalin for histology. I promise you something about staining. Staining for some people is a nightmare. I recognize sometimes it's difficult because you need to change very often the staining. Otherwise, you get a lot of things on the slide, even bacteria. So, and fungi. There are some species that are growing very well in methanol or in other type of these reagents. Yeah, they're living there, so you can have you can get them on the slide. To avoid this, you need to change them. I don't know, depends how often I use them. We change every week sometimes. But anyway, you can have on the market quick stain, and of course you enjoy this because you know it's a speed time and we don't have too much. I don't have that patience to wait 100 for each slide in normal stain like this one, like classic staining Grunwald Ginza. Of course, if I want to find something and to check something for some slides, I'm using. But usually, and I think you do it like that. Uh, Quick stain, it's very good. Quick Ginza, quick stain, and you know that there are many types on the market. I like Bioptic. I don't want to do advertising, but I'm buying whatever I find on the market cheap. Sometimes, and I have some tips, especially for reagent A, because this is going very fast. It's in based of methanol, and yeah, it's very fast going, and I'm doing like a mixture between 100% ethylic alcohol, and I put some ethanol on it, and the reagent A, it's very good. So, and it's cheap because you can buy 1 liter of methanol and 1 liter of um, um, alcohol, and you just mix them. You can put 70% ethanol and 30% methanol. And the reagent A, it's ready to use, and it's very good. This is a very dirty place. Actually, now it's very clean because I did a movie and I was ashamed to be very. So first reagent, when it's new, it's enough a few seconds. But when it's going off, I recommend to wait a little bit more in the first reagent, because yeah, the alcohol is not that powerful for a while. And then you need to wash them. But be careful because the water, the tap water, you don't need the distillated water or something special. It's tap water. but not very powerful. Yeah, because you can lose some cells on the stained surface. Yeah, and then you dry them. You can use a fan for drying or whatever, something to dry them. Of course, wrong technique. This is seems to be a very nice slide with feather edges, with margins, yeah, borders, very nice, one layer. But if you look very careful, the slide was gracy, so it's not very uniform. Yeah, it's not very uniform because some lipids, yeah, was on the slide before before you did the smears. It's a kind of imprints. I don't say it's too wrong, but in some parts are very thick. But honestly, you can have very nice areas here to yeah to have a good image. This is very thick. It's nothing for diagnosis. It's non-diagnosis, and usually I receive a lot from the clinics. And if I write down on the on the report was not proper slide, my colleagues is getting annoyed, and yeah, probably they, but it's fine. Yeah, I'll send them to check the slide if they are able to see something on this slide. Okay, it's fine. So too thick, very thick. This is a blood, come on. I need to find the babesia here. Yeah. Or here. If you use the very big needle, yeah, all the slides will be like this, full of blood. Yeah. It's nothing for cytology. It's nothing. You can see probably microphilaria here, but not more than that. As a reading technique, yeah, on the margins, the leukocytes are going because they are larger and thicker than red cells, and are going on the margins and on the at the end of the smear, feather edges. Yeah, you see here. Very nice picture from a book. I'll put the references by the end, at the end of the presentation for you. So this is yeah the end, feather edges. This is a counting area if you want to count the leukocytes, because in this area is a monolayer, and they are very nice. You see, very nice and uniform cells. You can count them. You can see the shape and yeah, all the details of the cells. Here on the beginning is very thick. Yeah, it's there are clusters, and it's difficult to see the shape and if it's something wrong on the cells. So if you want to do check, yeah, the cells on the margins, on the borders, even for babesia is another tip. They are going in on the margins, and check sometimes when you see the babesia on your slide, check where the cells are, because usually you find many erythrocytes with babesia on the borders. This zigzag, it's for counting, for leukocytes counting. This is a kind of technique to check a large area for counting. Yeah. Okay. So my frustration, as I said on the beginning, is when I receive the samples in a scrap paper, a small piece of paper. sometimes it's okay if it's something on that paper, the information, I can say it's fine, but is not allowed, shouldn't be allowed. Yeah, the submission form should be, of course, fill in with everything that we need, the information about sample, the information about owner, the information about animal, of course, which um, service do you ask, cytology, yeah, histopathology, bacteriology, ecology, and so on. And of course, your name, your stamp, and of course your address, that just to send the report. This is an example. Yeah. So try to put what is important for everybody, just to have a very nice uh, collaboration, because otherwise it's wasting time. All every day we need to call them to ask, where is the place, which samples is this one, from where, um, what do you want to do with that, are you asking for what, I mean, how to pack. um, you can provide from the market special boxes for the slides, yeah, small or big, depends, or you can put them on the covered, and but it's very important to be for them to be labeled. Don't put many slides from many uh, lesions, yeah, in the same box without label. At least you need to put the name of the animal, and you can say ABC, and your on your paper, on submission form, you can put the place, because sometimes we find the inflammation in some of them, and in some is a neoplasia, and the question is after that, where was the neoplasia. You have here a few references. Actually, this presentation is for technicians, but yeah, I think it's useful for everybody, but it's just basic. So thank you for your attention, and yeah, I don't say good night, because probably we have some questions.
Yes, we have. And thank you for your presentation. We have, for the moment, three questions. So Alina Dina has one question. How do you clean the 100 oil immersion objective?
I just use after examination, I have a handkerchief, so a piece of paper, very fine paper, and I just clean with the finger, as you do it for the glasses. If you do it very rare, but I wouldn't recommend, because in time the lenses are with the kind of stick. It's a glue actually, and that glue is going, if you use isopropylic alcohol. Everybody use the isopropylic alcohol, but isopropylic alcohol I'm using just when the image is not clear, and when I don't use the microscope for a while. But usually if you do with the paper, just very nice paper, sorry, and very fine paper, of course you don't have any problem.
Okay, another interesting question. It's from Dr. Mihai Marcu. What do you use to wipe the immersion oil off the slides after you read them? And do you want to put them into the storage?
Okay, nice question. I like that. So benzene or toluene. So you can put the benzene in a glass, and you can keep the slide with the oil, um, stained glass, and yeah, the oil is going and the stain is it's remain, so no problem. The quality of the slide, it's like in the beginning.
So I have to be really proud of Mihai, because he used to be my student at the BA paper. And congratulations, Mihai. And thank you again, Theo, for your amazing presentation. We have two more questions. One of the
No
questions
problem.
is from Catalin Kihaya. What kind of microscope do you use, and what kind of a microscope you used to have in that movie? And what do you use for shooting the images? Is that a camera included microscope, or is a simple microscope with a separate camera?
uh, it's a little bit shame because I invest a lot of money in very good camera. It's dedicated camera. I have Olympus camera on the microscope, but for the presentation, I didn't use. I used the iPhone. It was very easy. But yeah, I I don't say I have Carl Zeiss, I have Olympus, I have Nikon. So don't worry about that. Um, all of them are very good if you use careful, and you look after them, and keep clean, and yeah.
Okay, that's a good thing.
I don't want to say I don't like Chinese stuff. Sorry for that. I don't use that because yes, um, I'm using the microscope. I think I have almost 30 years because I start from university to use the microscope, and I'm wearing glasses this year. So for sure, if you use very strange microscopes, you lose your uh, visual clarity.
So just one question from Elvis Chuk. It's about workshop.
Any
So you
chance that one workshop will be available soon? So I'll see that. Uh, workshop, yeah, we thought about that since a while, but yeah, nowadays would be it's difficult, but for sure we can do on Zoom as well.
well,
We have
that's
a
a
lot
good
of material and very nice slides, and we are going to have the atlas or the books, and yeah, website. But the day is 24 hours.
thing. It's just 24 hours.
Yeah, but
About workshops.
yeah, we have young people that are coming, and if they give a hand, for sure, we will do very nice things. And yeah, we have
Well,
a
to be honest,
yeah.
Theo, about workshops, I've been giving a lot of thoughts about workshops, and I had the courage to open a workshop for October, and we were completely sold out. And now we are opening the second list for the second workshop. We have a workshop about the, let's say, renal patient, or a critical renal patient, and we have 20 places. It's a special concept. It's a 3-day team building, 3 days team building in a very beautiful hotel in the mountains, and we have 20 places.
Mhm.
The workshop is sold out, and we opened another list for 20 people. We have already 7 people for the second workshop. And if you guys want to catch up with the information, you can have it on the Facebook group. We have another question from Maria, happy birthday, Maria. Happy birthday to all of you celebrating your name day today. Can I prepare the lactophenol at the pharmacy? The ingredients, thank you.
Lactophenol, yes, there are some providers that mm, can yeah. Uh, you need to check on the internet. Lactophenol, it's not that difficult. It's not stringing. It's not something.
Jessica has one question. Is the ethanol plus methanol combination also good for HE staining?
Good question. HE staining is for histology, so I wouldn't use that. So the mixture between methanol and ethanol I'm using for reagent A, yeah, for cytology. Usually for histopathology, we have ready to use on the market, and or we have powder, and our technicians, it's like in the um kitchen, we have a recipe, and you follow very strictly the recipe, and you get the stains for hematoxylin eosin on histology. If that was the question, if I
Yep.
understand well, because yeah.
You have more than 30 thank you messages, and of course, you have a message from Valentin Cipriano Ofițeru, our colleague.
Mhm.
Hello, Vali. I don't have any questions, but I want to thank you, Theo, for your support all these years, and we appreciate your help. Thank you, Theo. See you soon. And a message for me. Chip, all the best
I
for you.
I I hope was not boring. I hope
No,
was
it was
fruitful,
good.
and
I was here for entire period. It was fascinating. You have another question, and the last one from Bianca.
yeah.
What is the best way to clean the slides with blood smear if you want to reuse them, or is best to just get new ones? So it's like, do you reuse your
No. Yeah,
slides?
I understand the question. Sorry, Alex, that I interrupt you, but yeah, I wouldn't go for that. They are very cheap and it's pity, and some of them better to throw in the bin. It's nightmare to clean them, and yeah, I wouldn't do that. It's just waste time, and even if you have good reagents, the glass is not very clear. So yeah,
That's a
maybe I don't know, maybe for urine sediment, for some sediment, or for some slides for parasites, you can do that, but come on, it's not that very expensive on the market. And anyway, if you do this service, the owner should pay that somehow, because otherwise, yeah.
or as I
Sorry,
do
yeah,
with the sperm
it's my
cells when I just do
yeah,
smear
yeah,
for sperm cells.
yeah.
The last question, methanol solution, is it better to keep it in the fridge?
Check the please check the
Oh,
provider,
the label. Yep.
yeah, the label, because I uh, I don't do that. Yeah, it's a good question, but our um, reagents are not for a long time, so yeah, I don't keep them too much, because yeah, we are using daily. It's daily use, but yeah, probably for large amount of reagent, is better to ask the provider or check the label. Yeah,
So
some
Theo,
of
we
them
have
are. Yeah.
on the phone, we have like 15 messages, not
Mhm.
on Facebook, not on the Zoom. We have on my phone. And all of them are like, congratulations, thank you for choosing Theo, thank you for your presentation, thank you for the entire webinar, blah, blah, blah. This is like, let's say, people from all over the world. I don't want to, keep this secret. You have 3 messages. One is from China, one is from Peru, and the other one is from Serbia. People are saying thank you. They say it was a very interesting and useful presentation. I would like to say hi to Radu. All the best for you there in UK. I'm really happy to see you live because I know how much this means for you and how much do you want to stay with us every Tuesday and Friday night, Radu. Thank you for being here with us. We have 220 people from all over the world, and thank you guys for being here. But I would like to especially say thank you, Theo, for what you have done during these 30 years using the microscope and giving a lot of useful information to all of us throughout our work in veterinary medicine. So that means a lot for us, and congratulations and thank you again. If you
I'm
want to say a
pleased.
few words.
Thank you very much. It was a pleasure.
And I just, I want to say cheers to all of you, and have a great night. Thank you again for being with us, and hope to see you soon. Soon means on Friday night when we get bored together about nutrition in renal patients. So guys, thank you again. Thank you so much, Theo. All
Bye
the best
bye.
for you,
Good night.
and good night.
Good night.